Good morning, everyone. Good morning. Good morning. It's Alicia Hurt here at the Women's Wellness Center. I see my baby, and we are here for another class in our birth series. Today, we are talking about mastering the breathing techniques for all stages of pregnancy. As I always ask, please like and share because you never know who needs this information. You never know. I am going to change the settings so that you can share. And then I am going to place our handles in the chat so that you can keep up with all of the events that we have going. You can watch previous classes. You know the spiel. And we're going to jump right in because we have a busy day today. Yes. We are out in the field supporting local business owners, helping clients. Today, we are supporting our queens. So we have our Yoni Seam special. All right, here we go. Again, we're at the Women's Wellness Center, 310 South Scott Street in Bainbridge, Georgia. Phone number 229-939-3240. We're open Monday through Friday, 9 a.m. to 2:30 p.m. and on Saturdays by appointments only. And we do observe all holidays. So, introduction to breathing techniques. As you can see from this photo, it is truly important. Mom is going through it and she is breathing. So I want to welcome you to our in-depth session on breathing techniques for labor. This class is dedicated to equipping you with the knowledge and practice of breath control to enhance your labor experience. So understanding the role of breathing, of breath, in pain management, relaxation, and endurance. Breathing properly during labor can help reduce pain and keep you focused and give your body the oxygen it needs to function efficiently, ladies. So it's very important. This is very important, especially for my clients that are getting ready to give birth because you need this. You may not know the terms that we'll go over, but you'll remember how to do it. And if not, I'll be alongside you. All right. So we're going to do an overview today of all of the different breathing techniques and when you need to use them and their benefits in labor. And also know that each technique will be broken down into when it is most effective and how to implement it in real-time situations. So throughout your pregnancy journey. So what's the science behind it? Well, I'll tell you. So behind breathing and labor, how deep breathing helps with oxygen and relaxation. The deep breathing, it increases the oxygen levels in the blood, which is essential for both mother and baby, and it helps to prevent hyperventilation. The role of breathing is in reducing tension and conserving your energy, especially during labor. The continuous controlled breathing, it prevents unnecessary muscle tension and it allows your body to work efficiently during the contractions. The connection between controlled breathing and pain perception, it's slow, it's steady breathing, and then it can signal the brain to release endorphins and the body's natural painkillers. So for all those moms that say, you know what, I don't want to take any meds during the labor process, then breathing is the key. This class is critical for you to practice those techniques, prepare yourself for labor. And as it says, it is a way to release those endorphins because it is a natural painkiller and it reduces the intensity of contractions. Studies show that slow, deep breathing, it lowers your levels, lowers your cortisol levels. It reduces stress and it increases the release of endorphins, the body's natural painkillers. And women who use controlled breathing techniques are often reported a more manageable labor experience. Who wants a manageable labor experience? I know I did. I did, and that is why I am supporting you now, because I know you do too. And this is good for the support person as well, not just the mom, because if you're able to learn these techniques, if the mom is fatigued, which she will be, and she's just like, oh my goodness. And so coping mechanisms would be, come on, let's go and do these breathing exercises. You got this. Help them, go alongside with them. Again, it helps with stress reduction and emotional well-being, because when you focus on the slow and mindful breaths, it definitely activates your body to relax. And that will be your body's response automatically. It helps to lower your heart rate and promote feelings of calm. And honestly, you can use these techniques even if you're not pregnant, for real. If you suffer with anxiety, if you are trying to slow your brain down, like at nighttime, and you're like, I really need to get some rest, I don't want to take anything to go to sleep, you can use these techniques as well. So again, it is not just for the pregnant woman, but that is the purpose today. Again, it prepares you for labor and childbirth. It equips you. It gives you the control. And, you know, like me, I'm like, I gotta be in control, even though I'm not in control. But with breathing, it can help you to manage that pain, to reduce the likelihood of panic, especially when the baby's starting to come on down, right? You may start to panic, but if you breathe and really center yourself, it will promote a smoother birthing process, and it gives you a positive impact on maternal and fetal health. Mindful breathing, it definitely helps the fetal well-being as well, because the baby won't feel so distressed, right? The baby feels what you feel. And research shows that. It suggests that stress management in expectant mothers can reduce risk of preterm labor and low birth weight. Breathing exercises during pregnancy can increase your blood oxygen levels again and help you to bring a steady flow of oxygenated blood to the baby. And we want that baby to feel good, to be calm, to then come into the world naturally and without any distress. Okay, so let's jump right into the breathing techniques to use during pregnancy. Okay, so the first one you see here on the screen, it promotes relaxation, right? The cycle. It promotes relaxation, it promotes stress relief, and it helps you to find basically you centering yourself, you're being mindful. And as you can see in the picture, mom is way into her labor process. She has her support person there with her. So with this breathing technique, it will support her in channeling herself, focusing in on those contractions coming and pushing the baby out. And so they say you want to make sure you have a comfortable position. So you want to either sit or lie with a straight back in a position that does not put pressure on your abdomen. So see how mom is kind of laying back there on the tub, just laying back. And you want to inhale slowly. And you want to breathe deeply through your nose, which will allow your abdomen rather than your chest to expand fully. And then you want to exhale gently and then breathe out slowly through your mouth or your nose, letting your body release tension. And then repeat it. Continue this breathing pattern for 5 to 10 minutes and focus on the rhythm of your breath and the sensation of relaxation that deepens with each cycle, right? All right, so the next breathing that you see was 2 here. The next one we're going to go over is the interval breathing. And as you can see mom there, she's like, all right, it's time to do this. And she's in a hospital setting. So this breathing is also known as box breathing, and it can help manage anxiety and prepare for intensity of labor. And you find a relaxed position for this one. So you can sit or lie down similar to the other one. but you want to be comfortable and ensure that your body is supported. And you want to breathe in for 4. 1, 2, 3, 4. Inhale deeply through your nose for a count of 4 and filling up your lungs and your abdomen with air. And then you want to hold it for 4. 1, 2, 3, 4. Hold your breath for a count of 4 as the oxygen circulates through your body. And then again, exhale for 4. 1, 2, 3, 4. And breathe out slowly through your mouth, releasing all the air and any tension. And then again, hold it for 4. 1, 2, 3, 4. And then you're going to pause, rest, pause, and then repeat it. Repeat it all over again. You're going to go to breathe in for 4, hold for 4, exhale for 4, hold for 4, and then pause, and then repeat it. And again, this helps to manage anxiety and prepare you for the intensity of labor. And as I said before, yes, this is for labor, but if you suffer with any type of anxiety, any mental health concerns or opportunities, if you are like me at night, your mind is racing and you really want to calm down, you can use these breathing techniques to support you in that. You definitely can use it. All right, so number 3, the next breathing technique is the alternate nostril breathing. The alternate nostril breathing. And this technique can help to balance the body and the mind. The body and the mind. Again, you want to sit comfortably and try sitting with your legs crossed and your back straight up. Your back straight up. And you want to prepare your hands and use your right thumb to gently close your right nostril. Again, if you're doing it with me right now, your right thumb, gently close your right nostril. And then inhale in the left, right? Inhale deeply through your left nostril. You got that? All right, and then you're going to switch. And you're going to close your left nostril with your finger, and then release your right nostril. So left finger, left nostril, and then release with your right nostril. And then you're going to inhale right. So you breathe out through your right nostril. And then you inhale right and you breathe through your right nostril. And then switch again. So now you're going to do the left. So you're going to inhale, you're going to exhale right. So breathe out through your left nostril. Then you're going to inhale left, breathe in through your left nostril. And then you're going to continue it, meaning repeat this pattern for several cycles until you feel the balance of your body and your mind. So what does that look like? Again, sitting comfortably, cross your legs or have your back straight and prepare your hands. So we're going to start with the right and then we're going to switch to the left. So your right hand, your right thumb is going to gently close your right nostril. And then you're going to inhale deeply through your left nostril. Then you're going to switch. You're going to have your left thumb and you're going to gently close your left nostril. And then you're going to breathe through your right nostril. And then you're going to exhale right. You're going to inhale right. And then you're going to switch. And then you're going to inhale left, exhale left, inhale left. And then you continue this pattern until you feel that you are focusing on the flow of your breath through each nostril and you feel a relief within your body. Hopefully that was helpful. So breathing exercises to find relief during contractions. So we have the focused deep breathing and then the visualization breathing. So for the focused breathing, this one will help you to stay calm and in control as contractions begin. So you start with the contraction. Your team will show you on the monitor if you're hooked up to a monitor, or you'll feel it coming. So as soon as you feel a contraction starting, you want to focus on your breath. So you inhale deeply. Take a slow, deep breath in through your nose, concentrating on filling your lungs completely. You want to visualize the air flowing down to your abdomen. Then you want to exhale slowly, gently exhale through your mouth, trying to keep your breath steady and smooth. And imagine the tension leaving your body with each breath, and then repeat it. You want to continue this pattern throughout the contraction, focusing solely on your breathing to help divert your mind from the pain and provide a sense of control. So again, inhale deeply. Take a slow, deep breath in through your nose, concentrating on filling your lungs completely. And you want to visualize your airflow down to your abdomen. And then exhale slowly. Gently exhale through your mouth, trying to keep your breath steady and smooth. And imagine the tension leaving your body with each breath out. And just continue this until you feel calm and in control. The next one is visualization breathing. So you're combining the breathing with visualization. So you're adding to the focus, deep breathing. And this can significantly enhance its effectiveness during your contractions. Also during anxiety, if you're having a panic attack, this would definitely help to center you and to bring you back into alignment and into control. So you start with the deep breath. As the contraction begins, breathe in deeply and imagine a wave of relaxation sweeping over your body. Visualize the peak. At the peak of the contraction, practice visualization by imagining riding the top of a wave. It's so freeing, so relaxing. Ride that wave and maintain a steady breathing pattern, imagining yourself smoothly gliding over the wave. Exhale and visualize release. As the contraction subsides, you exhale deeply, visualizing the wave gently receding. Imagine any discomfort flowing away, flowing out of your fingertips, out of your toes, just going away. Now we're talking about rhythmic breathing. As you can see in the photo, she is aligning her heart with her abdomen there, her baby, and she is helping herself to distract from contraction pain and helping her to feel more relaxed. So you want to find that rhythm. As the contraction begins, you establish a comfortable breathing rhythm, such as inhaling for 3, 1, 2, 3, and exhaling for 3, 1, 2, 3. Maintain the rhythm and focus on maintaining this rhythm throughout the contraction, matching your breath to a specific count can help keep your mind occupied. Again, inhaling for 3, 1, 2, 3. Exhaling for 3. Exhaling 1, 2, 3. And use a mantra. Try silently repeating a calming word or phrase with each exhale, like relax, 1, 2, 3. Exhale, let go, 1, 2, 3. to reinforce the sense of calm. Now, this next one is gentle movement breathing. Gentle movement breathing. And with this breathing, it can provide relief during contractions, and it combines with movement. Are you ready? Let's combine with the movement, you guys. So during a contraction, you'll gently sway or rock back and forth, back and forth. And then you'll sync your breath with the movement, back and forth, back and forth. Synchronize your breathing with the movements and inhale as you move in one direction. Exhale as you move back. And I'm talking this way on purpose because I want you to really feel the movement as you practice this gentle breathing strategy. And this can help to distract from any pain and enhance relaxation. So breathing techniques to help you breathe through labor. Okay, Lamaze breathing. I remember this. And you see her support person holding on to her. I got you, sis. And it helps you to focus your breathing to reduce the perception of pain during labor. You focus again on that breathing. You begin with deep, slow breaths through your nose, exhaling through your mouth. Again, deep, slow breaths through your nose and exhaling through your mouth to maintain a sense of calm as labor starts. And then you transition as contractions build, you switch to lighter, more rapid breaths to maintain pain and distract from discomfort. And you use visual aids. So focus on a visual point in the room, maybe a picture, something on the wall there, your spouse. Or you can just imagine a peaceful scene while practicing your Lamaze breathing. So for me, it would be the water and just watching the water, watching the waves, watching it as it crashes onto the sand. And you continue to breathe deep, slow breaths through your nose, exhaling through your mouth. Number 2 is the pant, pants, blow breathing. Pant, pants, blow breathing. This technique is particularly useful during the peak of contractions. Short, quick breaths. As a contraction peaks, take short, shallow breaths, almost like panting. This can be thought of as pant pant. A long exhale. Follow the pant pant breaths with a longer, more pronounced exhale, similar to a blow. Then you repeat it during peak contraction. Repeat to help you stay focused and reduce discomfort. So again, short, quick breaths at the peak. That's one. And then you progress with the long exhale. So you follow your panting with the blow. And you repeat it. That's the pant, pant, blow, breathing. All right, number 3, the belly breathing during labor. So as you can see, this mama, she's like, help me, I need your support. Her support system is there. She's a nurse in the facility, and she's going to help her through the belly breathing and the mindful breathing. So belly breathing is effective for relaxation and can be used in between or during contractions. So you place one hand on your belly, you position your hand on your belly just below your ribs and rest the other hand on your chest, similar to the photo in the previous slide. You inhale deeply through your nose. You're letting your belly push your hand out. So you should feel your hand moving as you are inhaling deeply through your nose and then pushing out with your hand. And then your chest should remain relatively still because you're pushing out through your belly. You want to exhale through your pursed lips, feeling your belly fall inward. And this helps to extend the exhale and promote relaxation. You want to continue this and use this technique during labor, especially during breaks in between those contractions. Now for mindful breathing. Mindfulness can enhance calmness and focus on breathing techniques during labor. You want to stay present and you want to focus on each breath, being mindful of the sensation of air entering and leaving your body. You want to acknowledge the pain without reacting. It's there, but we're not reacting. We want to recognize each contraction and any discomfort it brings, but try to maintain a calm breathing pattern without reacting strongly to the pain. And use as a grounding technique. Whenever you feel overwhelmed, return to your focus to your breath. Return that focus to your breath. So you start feeling overwhelmed, panicking. Oh my goodness, get this baby out. You return to your focus of your breathing, of your breath, and using it as a grounding tool to bring you back to the state of calmness. All right, you guys. So if you want to practice more, please replay this video. It will be on our YouTube channel. It is crucial. It is vital. It is so important to practice breathing techniques before labor. Just like any skill, breathing techniques work best when practiced in advance. Expecting mothers should incorporate these techniques into their daily routine to build muscle memory and ease anxiety about labor. Remember, choosing the right breathing technique for each stage of labor. Different stages require different approaches. Early labor benefits from slow, deep breathing, while active labor may require more structured patterns. Knowing when to transition between techniques can improve comfort and focus. And the encouragement to work with a birth partner or a doula for support. Breathing is more effective when a partner provides guidance and reassurance. And having a trained birth partner or doula can help maintain consistency in breathing and relaxation techniques. So here are some final words of encouragement. You want to trust your body and your breath. Every labor is unique. Not one is the same, okay? But breathing remains a powerful tool, ladies. Trusting your body's natural ability and focusing on steady, controlled breath work can make a significant difference in your labor experience. So here's my information. We do support with doula services. So that way, as you're practicing breathing, we're alongside you to say, you got this. And if you forget, don't worry about the technique. We'll just help you to breathe along the way to bring your baby forth. So please keep in touch with us. We are here for you every step of your journey. You are not alone. You can reach out to us. You can do a walk-in at 310 South Scott Street, Bainbridge, Georgia, 39819. You can call us at 229-939-3240. You can email us at info@icmybaby.org. And we have a lot of information on our website. Check it out, icmybaby.org. And you can join our email distribution list so that way you can keep up with everything we have going on. Again, we support with counseling and therapy. We have a safe space here to support our community. We do massage therapy and body work. And Miss Deborah Brock, she specializes in prenatal massages. We have programs and classes such as this, both in person and virtual. We have healing retreats, both local and international. And we have online resources. And after you have that baby, or if you're not expecting and you want to have a holistic treatment for your overall womb health and relaxation, your emotional well-being, and supporting your menstrual health, we can do the yoni steaming for you here as well. Again, my name is Alicia Hurt. I am so happy that you stopped by to listen in and to learn with us. You all have a wonderful day. Love y'all.